Everyone, and thank you very much for joining us for this UICC virtual dialogue on cancer and UHC. We are delighted that you're all able to join us. We're going to give a few minutes for people to join the call. And in that time, I just wanted to ask everyone to make sure that you're muted for the first part of the conversation, where we'll be hearing from our speakers. And then for the second part of the conversation, it's going to be much more interactive. So raise your hands, drop questions into the chat function. We also have translation available. So please do just select the language that you would prefer in the menu below. And our fantastic interpreter, Julia, will be providing that translation services. So in the meantime, while everybody's joining, we wanted to kick off with a little bit of an interactive activity. So what we'll be doing is opening up a whiteboard, and we have a couple of key questions for you. And those are, how much do you know about the upcoming UN high-level meeting on universal health coverage? And what is it that you'd like to get out of this discussion? So hopefully you should see the questions popping up in just a second or two. And you can respond in either English or in Spanish. And this will give our excellent speakers a bit of a sense of the level of expertise we have in the room and what kind of topics you guys are most interested in. So it's an interactive whiteboard. Feel free to drop your answers in and just let us know. Fantastic. I can see lots of different cursors over there. I'm not sure if everyone is able to contribute or not, but we are starting to see some excellent feedback. While people are responding to that, I'll kick off our session. So over the next hour, we're going to be having a chat with some excellent speakers. We'll be kicking off with Kerry James, who's CEO of the World Hepatitis Alliance, and who's also a member of the Civil Society Engagement Mechanism Board and the Board Advisory Group of UHC 2030. And he's going to be providing us with an introduction to what the high-level meetings are, what we can expect this year, some of the key themes and how to get involved. And then we're going to move the conversation across to two of the members of our own community, the cancer community, who are going to be telling us a little bit about their experiences engaging with high-level meetings, how they've used it, what the outcomes have been, to hopefully give everyone a sense of what it is that we can achieve together. Then we'll turn things over to you guys and we'll invite you all to join some breakout rooms where you can have a chat about what it is that you'd like to see coming out of this high-level meeting. And then we'll try and bring that all together. So just as a quick reminder, this is an open call, so if you wouldn't mind keeping yourself on mute for the structured part of the discussion, and then we'll open up the lines for a Q&A. If you have any questions, you can also drop them into the chat function, And Julia, our expert interpreter, will be providing interpretation, so you just need to select the language that you're most interested in. So I think we've seen some interesting responses so far. We've seen a little bit of engagement so far, some interest in understanding the needs of cancer professionals and patients, a little bit of interest in understanding kind of the impact of the pandemic, and how we can kind of respond to that. So what I'll do is I'll actually close the whiteboard now, and then we'll go back to standard presentation, and we'll be handing over to Kerry first of all. So Kerry, thank you so much for joining us today. It's a real pleasure to have you. And I think I'll probably kick off with a fairly open question. What is a high-level meeting? Can you give us a little bit of a background?
Sure. First of all, thank you so much for inviting me to be here today. It's great to be with all of you. So a high-level meeting it's a United Nations meeting, which is called on through a resolution at the General Assembly. And it's generally for an issue that needs kind of urgent attention, or is a very important topic of the day. And the real purpose is for trying to reach agreement on cooperative measures and solutions on kind of important health, important issues. You'll see that some responses have had multiple high-level meetings, like there was another high-level meeting for UHC in 2019. So it also provides an opportunity to kind of look back at the previous high-level meeting and to measure any kind of progress on the commitments. And generally, some of the main aspects of the high-level meetings are there's a multi-stakeholder event, which for the UHC high-level meeting will be either at the end of April or the beginning of May. The date still hasn't been announced, unfortunately. And then the actual event during the UN General Assembly in September. And as part of the meeting, there's a political declaration, which is drafted in consultation with countries, and there is opportunities for civil society to also feed into that process. And then the meeting itself is really designed to bring these issues to the attention of heads of state and to the very top leadership, top levels of global leadership. So you'll have an opening session with some global leaders. Generally, then you will have a session where any UN country can make a statement, very similar to like a WHO, a World Health Assembly, or a UN General Assembly. So the countries will go around and make statements relating to the topic. And then there'll be some plenary sessions as well on different, whatever topics they choose for that particular meeting. So I think for the last UHC high-level meeting, the two plenary sessions were on equity, and the second one was on financing. And as part of that, as part of the event, organizations with ECOSOC status, so organizations in official relations with the United Nations, may, that's the important word, may have the opportunity to make a statement as well after the countries are finished. But if there's a shortage of time, if the countries run over, that time for civil society, non-state actors is often limited. So maybe I'll just stop there. Thanks.
Fantastic. Thank you, Kerry. No, that was a great summary of quite a complex process and quite a busy day. You mentioned sort of the idea behind a high-level meeting is to come up with an agreement on kind of cooperative solutions, and you mentioned sort of political declarations. So, I mean, what was the result of the last high-level meeting on UHC? What point are we working from at the moment?
So I think the timing of the last high-level meeting on UHC, I mean, it was in 2019. So then all of a sudden we had COVID in 2020 and everything changed, right? Especially in terms of health systems. So I think that has been a challenge going into this high-level meeting, because even the vocabulary around health and global health has changed since 2019. I mean, now what, the big topics of conversation are health security and pandemic preparedness and all kinds of other things, which are actually part of providing a universal healthcare system. But the kind of terminologies have sort of changed. So I think that's one big challenge or one big thing that's really happened since the last high-level meeting. There's a document that kind of lays out the different commitments within the last political declaration. I think the challenge always with these kind of UN events is they do have, there are kind of commitments that are made, but the measurement of these commitments is slightly amorphous. It's very hard to get anyone or any countries to agree to too stringent of targets. But in the last political declaration, some of the commitments were around ensuring political leadership beyond health, a commitment to leave no one behind. And I think that's probably one thing that the 2019 meeting really did, was really establish the principle of health as a human right. And now everyone, everywhere, no matter where you live, no matter your economic status, your age, your race, your sexual orientation, everyone is entitled to good health and healthcare that's affordable, right? That won't force anyone into poverty. There was a commitment around regulating and legislating or removing regulations that inhibited people from accessing healthcare. Upholding quality of care was a commitment. There was a commitment to invest more and invest better in health, and to move together. So to have a multi-stakeholder response in health. And then there were also commitments around gender equality, and even in 2019 around emergency preparedness. And I don't think anyone knew just how quickly they would need those at the time. So you can see it's a wide-ranging list of commitments. There are milestones in there, and when we share the document, you'll kind of be able to see them. But there's no numbers, right? There's no kind of concrete thing you can necessarily measure countries against, but there are some kind of aspirations around progress on those points. So as we go into this one, obviously it's a time to reflect on those commitments and just see, kind of look at any progress that's been made, or how can we interpret any progress or any areas that need to be sped up. Thanks.
Absolutely. Thank you for that, Kerry. That's a really great overview of what is quite a long, quite a heavily negotiated document. And I think one of the key things that the team here at UICC learned through the last high-level meeting was really, as you say, it tends not to be specific commitments on diseases, but it's looking at how governments and stakeholders, including civil society, can kind of come around and put in place the building blocks of that UHC response. And I really liked your language around, really making health as a human right a completely normal concept, really bringing that to the fore. And I think that was really well reflected, as you say, in the sort of two focus dialogues that we saw on the day itself, in equity and financing. You've also mentioned COVID-19, but what key topics do you think are going to be high on the agenda for the negotiations this time around? If you've got a sense of, member states and other health communities are really concerned about, probably, I imagine, COVID-19 response and recovery, but is there anything else that you think is going to be a hot topic that we should be aware of?
Sure. I mean, I think the interesting thing this year is there's actually 3 high-level meetings happening back to back. So there's the high-level meeting on UHC. There's a whole high-level meeting on pandemic preparedness response. And there's also a high-level meeting on TB, which is a kind of, I don't know, it's almost a parable of where we are in global health, because UHC is about everyone kind of moving together, a holistic approach to health, a person-centered approach to health, which isn't about individual disease responses, but it's about, caring for the individual where they are and how they want their services delivered, right? And I think the whole concept of pandemic preparedness response, I mean, obviously you need special things in place, but having a strong UHC system in your country is probably the best way that you could be prepared for the next pandemic. So we're trying to work together with the groups organizing all three of the HLMs to see where we can find synergies, see where we can avoid duplication, because obviously each meeting wants the political leaders there. Each meeting wants the countries to participate in a meaningful way. But, we know that people have, leaders have different commitments on times and things like that. So I think, as I said before, this happening after COVID-19, I think it's really time to take stock and really look at what we mean by UHC and how UHC kind of is part of health security, is part of pandemic preparedness, and how we're all kind of talking about the same thing, but in different ways, and to try to reclaim the middle ground that actually our ultimate goal is, equitable healthcare for everyone. And along with that, I think there's like several themes that have been coming out just kind of generally, I think, in global health in the last 5 years. One of them is having a person-centered approach, having a holistic approach to health. So kind of moving away from specific disease responses and more towards an integrated approach, and making sure that every contact that we have with members of our communities, we really make it count. So we're not testing them for just one thing. We're testing them for multiple things, or treating them for multiple things. We have a health system that's able to recognize like common risk factors, like for instance, hepatitis and liver cancer. Do you know what I mean? If you're screening for hepatitis and they have a positive result, then they should then be put on a schedule for screening for liver cancer. So it's also about those things, and as part of that kind of integrating programs, I think if you're talking about global health in sort of low and middle income countries, there's a huge amount of infrastructure that's been built around HIV, around TB, around malaria. And instead of trying to build new structures, the integration within these existing structures for everything could be really important in a way to fast track a lot of these things. And always at the center of UHC conversations is the importance of primary care, and how primary care can be a pathway to health generally, and healthcare workforce issues, making sure that we have a supported and stable healthcare workforce around the world. Thanks.
Fantastic. And I think it's great to hear about those kinds of themes, and I think it's really interesting, as you say, that we've got these 3 high-level meetings together, and how can they come together most effectively. And it's, I think, as a community, we're really overjoyed to hear about the discussion around people-centered care and making the most of every contact that a person has with the health system, because that's where we're seeing the most progress, particularly for things like women's cancers, cervical, breast. And I think that integrated approach is something that we've been trying to work on. So it's great to hear that there's an open door for that in terms of collaborating with other health communities. On that sort of collaboration theme, you've had quite a bit of experience, particularly in the last high-level meeting. How is it that the hepatitis community got involved in the last high-level meeting, and what did you learn from that process that you can share with us?
Well, for the last high-level meeting, I wasn't actually on the CSEM at the time, so I just went as someone was seeing that this was this was important, and really, you'll maybe have all your experiences, and maybe it's similar in some of the work that you do, but the hepatitis response is really has been quite kind of sequestered away. It's been quite separated from other things, and it's tended to be not very well integrated within health systems, right? Just like my example before, viral hepatitis, chronic infection, is one of the leading causes of liver cancer. There's very few places in the world where where that's actually recognized by the health systems, and those connections are being made. And so we just kind of went there to be part of it, to start these conversations, to be part of this new response. And through that, and so then I joined the CSEM, which is the Civil Society Engagement Mechanism for UHC 2030, which is it's a multi-stakeholder group, which is hosted by the World Bank and the WHO, which has a steering group which kind of discuss some of these global topics. We try to kind of move some pieces around, create some opportunities for collaboration. So I joined the CSEM, and then they have like a Google group or a listserv. And through that, we actually saw they were feeding through the drafts of the political declaration. And for the zero draft of the political declaration, it was all very like what you would expect, right? So very high level, collaborative language around UHC and multi-disease responses. But then by about draft 4, there were lots of specific diseases mentioned there, especially HIV, TB, and malaria, as you would expect. But of course, hepatitis wasn't included. So it offered us an opportunity to lobby, to find out who we knew that was in part of the process, and really lobby for hepatitis to be, included in those areas where it was going to be appropriate. And that actually happened. So that was a very exciting moment for us. And I think just kind of shows how, community organizations through things like CSEM can actually engage with the process on that higher level and kind of really make things happen. But we went during the if you're able to be, well, at the time in person, but now virtually, there'll be loads of events and side meetings and things like that, even beyond the high level meeting, which will bring people together and are really good opportunities for networking and like making new connections and forging new partnerships. Thanks.
Fantastic. Thank you for that, Kerry. And you've already covered the last question where I was going to ask you, which is a little bit, how is it that people can get involved? If there are people on the call today who are super interested, what would be your 2 or 3 recommendations to get involved?
So I would definitely recommend joining the CSEM group on the website. So you can just sign up, and there's like a Google group, and people post updates about what's happening, different meetings, different events. I mean, CSEM is like 2 parts. It's like that larger group, and then there's an advisory group, which I'm part of, which also helps organize the events. But that'll really keep you up to date on what's happening for civil society. And there'll be lots of things going on. I mean, I think it's a real opportunity to use the fact that there is a high level meeting to engage decision makers on a national level, or even on a local level, to say, look, this is important. This is happening in New York. What are you, what are you guys doing about it? Where's UHC and cancer in your plans? How are you addressing these things? And even coming up with your own kind of priorities locally, and then using it as an opportunity to do that. I mean, obviously, if you do engage with your on ministry level, it's an opportunity to engage with them around the high level meeting, engage with them around what their declaration is going to be at the meeting, and kind of give your views on what the priorities should be. And then I guess thirdly, it is just around the meetings themselves, either virtually or if you're lucky enough to be able to travel to New York. There'll be lots of opportunities for networking and for making new connections. And that's really what it's about. I think for me, that's really kind of where the most meaningful partnerships came for us. It may even be how I made the first connection with UICC. Sonali, I can't remember what meeting that was, but it was, there's definitely, I've made so many connections that have helped really open my eyes to the possibilities of how I can do my job better within health systems, and also just how, partnerships can be so valuable. Thanks.
Fantastic. Thank you so much for that, Kerry. And we've had a few questions around sort of where people can access some of the resources you've mentioned. So what we'll do is we'll have a chat with Kerry, we'll compile a list, and we'll send it to everyone after the call as well. So you don't have to worry about Googling things. We'll try and condense it for you. Thank you so much, Kerry. And I really like the point you made about sort of engaging at the local and national level and building those kind of partnerships. And it sort of very smoothly helps me transition to our fireside chats. So I wanted to sort of introduce everyone to Carmen Aust, who's from the Cancer Warriors Foundation in the Philippines. And Carmen has a very long track record in advocacy. And Carmen, I wanted to sort of get a sense of kind of how you've engaged in previous high-level meetings and what your experience has been like.
Actually, I was lucky to have the opportunity to be exposed to the UN high-level meetings on 2 levels. on the global level and on the national local level. On the global level, we have here with us Mr. Benson Pao, who used to be the president of Childhood Cancer International. And for the UN high-level meeting in 2011, the first one, he actually attended it because we told him it's such an important thing, because after the HIV/AIDS UN high-level meeting, this was only going to be like the second time that a UN high-level meeting was going to be called. And then because of his presence there, and this is how I see high-level meetings because of that experience as well, it served as an inspiration and propelled us, the childhood cancer community, to dream of actually collaborating with WHO. What followed was a visit to WHO Geneva offices, meeting with the NCD team, and we felt that in those collaborations, and then afterwards, just like the moving action, key principle of universal healthcare and the high-level meeting, we then engaged with the doctors from PSYOP and then other partners. And in 2018, you now have the Global Initiative for Childhood Cancer. And that was started because we were inspired by all of the promises and commitments. You can look at the promises and commitments and say, is that ever going to happen? Or you can look at it and say, well, if they can dream it, we can dream it and we can do it. And the other great story as well, in terms of how the 2011, the first high-level meeting inspired the birth of a global network, is that of NCD Child. NCD Child was merely a working group of NCD Alliance. But after that high-level meeting, those that were working with vulnerable children felt that they could spin off and create their own group. And again, we were there as well in the birth of NCD Child, and you know how active they are now. In the Philippines, on the other hand, so that was how it started. And then after that, the Philippines back home, and this is where those of us who are national and local advocates, our ministers of health and other members of our government, they prepare statements that either the president or the key leaders who will be attending the New York high-level meeting will be speaking about. And they often have not just an analysis of where the country is in, but as well they make certain commitments. And that is where actually we can get involved. And for me, on a personal level, after those meaningful global engagements, the national and local level was also something that was, in a sense, very fruitful, because it helps you to engage with your local political leaders. And at the same time, what Kerry had discussed, basically those are the 8 asks in terms of the high-level meetings. Those are things that when we discuss with them, we can emphasize, like invest better, invest more. For those of us in high-level, in low-middle income countries, that is a promise that we definitely want them to be able to deliver on. The moving together, we put it as moving as one, and that's what encourages in our country to form the Cancer Coalition Philippines, to have the Healthy Philippines NCD Alliance. It's like the getting together in terms of bringing to life not just the whole of government, but really the whole of society, and now the whole of systems approach. So Kerry's right in the sense of it could be like clouds that are up there, but there is the way that we as advocates, as prime movers, can bring it down to the level. And so in terms as well of no one being left behind, making sure that when we talk of cancer, for example, we talk as well of indigenous communities, indigenous peoples, because most often they're left behind. We talk as well of persons with disability, because again, most often they're left behind. So actually those 8 asks that Kerry had presented earlier, if you could meet with your group and try to localize and customize it, that will be a very big help, so that the preparation for the UN high-level meeting is actually a chance for you to be able to develop a plan for a shared future for your country.
Fantastic. Thank you, Carmen. And I think it's always really fantastic to hear about how different groups have been using these opportunities, because as you say, kind of discussions in New York can very much feel like the clouds. Like, it's somewhere over there and we know it's happening, but kind of think your point around sort of the importance of localizing this and helping to translate it into, from UN level political declaration speak into, well, concretely, this is what it means for our communities, you know, our country. Picking up on that and sort of expanding it a bit broader, what is it that you've kind of learned through your engagement in high-level meeting advocacy, in sort of using those processes to support the goals that you want to pursue? Are there any lessons learned in terms of planning country level action? Is there anything you'd like to share with everyone to sort of learn from what you've been doing so far?
I think one of the lessons that we've learned is we need to be able to see that the commitments and promises and the declaration statements that are made in the United Nations or for WHO, the World Health Assembly, that these are things that because the members of our country signed, these are things that we can then follow up and tell them, hey, you were a signatory to this, and these were some of the promises that you said. So how do we convert this into actual action and transform the situation that we have here now? Because most often we may look at it as that's simply a piece of paper, that's simply a declaration, you know, but it is actually something that we can leverage and maximize to the full. So both the declaration statements of the UN, and I think coupling it as well with World Health Assembly statements. Like in our country, we successfully spearheaded the passage of the NICA Law, National Integrated Cancer Control Act, together with the Universal Health Care. And for that, what we leveraged was the documents from the NCD high-level declarations, as well as the issuances of World Health Assembly in terms of integrated cancer control. A nice point about integrated in our country, we love the word comprehensive, but we have many laws that never get completed because of the word comprehensive. And because of that focus, both of the UN and WHO on the need for integration and integrative thing, that was really something that we in civil society fought, that no, it's not comprehensive law, it has to be an integrated law. And then at the same time, of course, what Kerry was saying in terms of people-centered, but as well the importance of being able to bring in messages with regards to gender equity, both in terms of men, women, boy, children, and especially the vulnerable and marginalized. So I think that's one in terms of mindset. Let's not look at it as simply politicians and our government leaders coming together to hobnob and come up with a document. Let's look at it as that document becomes a tool that we can utilize for advocacy and for being able to advance the shared goals that we have, both for cancer and for NCDs. And the other one that we also found very useful was in WHO came up with a guidance document where it's like they had the 6 eyes in terms of what we can bring to our government when we are discussing high level. Because I think the other important thing to learn is you engage them before they go to New York, and then when they come back, of course, give them time to breathe. So, 2 months at least. Then when they come back, you arrange for a meeting and then you say, congratulations, we were so happy. However, we'd like to follow up, And the eyes that are very important would be, again, in terms of integration, where for cancer, it would be, integrating women's cancer, both breast and cervical cancer, or integrating for childhood cancer, the under 5 programs, or any other programs that you have, especially in terms of strengthening primary health care. And then from their innovations, their new and better ways. And oftentimes we may get frustrated and feel, I'm in a low middle income country, they don't even have a budget for this. How can I be innovative? The more you have to be innovative, which brings you to the third eye, which is investment. Our governments, even if they are low middle income countries, are not really zero budget. There are budgets there, and their budget as well in terms of the private sector. But we need to be open to the possibility that we can unlock these various income streams. I think most often, especially when we're very much on the ground like we are, and for children with cancer, seeing them dying and so on, and you feel, there's no way this will ever improve. So again, that very important mindset that we have the power if we come together to unlock these various investment opportunities and income streams. And then they have the other eye in terms of inspire. That I like very much. I think for us to make the UNHLM commitments and promises come alive, first we have to inspire each other, so then we can inspire the wider community. Because only in that sense, does this go beyond documents? This becomes like frameworks for actions. This becomes like, you know, what propels us to move towards high impact initiatives together. Maybe
Fantastic.
I'm optimistic, but we've seen it happen. So
I think we don't have enough optimism as well, Carmen. Like, we definitely need more optimism. It's too easy to get jaded. And I guess my final question to you is a relatively quick one. What do you want to see us, as thinking about us, the cancer community and the broader health community, achieve in 2023? What do you think we should aim for?
Well, what Kerry was saying in terms of resiliency is definitely something that we need to look at, but not just resiliency in terms of health system strengthening, but as well resiliency in terms of the cancer community, because we know that in terms of mental health, all of the reports have said, especially our young people have been so hit by the pandemic because of the feeling, what's the future about when I'm not even sure when COVID would stop, and then there's no one coming in, and so on and so forth. But the other thing as well is really access to more affordable essential medicines. I think whether you're in cancer or hepatitis or any other form of chronic disease, that is a major cause of what they're now calling financial toxicity. It's not just financial hardship or catastrophic cost. They've now coined the term of financial toxicity in the sense of there's the financial hardship, and then there's the mental distress. In our country, they call it cancer of the pocket, meaning you have no money to spend on cancer treatment. So you have two types of cancer. But I think that's something that should be addressed. There should be a phrase somewhere in terms of encouraging countries and the international development organizations to be able to design appropriate market shaping interventions that goes beyond just full procurement. I'm sure that there are very many innovative and creative people, you know, in the United Nations, WHO, that will be able to come up. Definitely, we need innovations in that. And then, of course, in terms of the transformation of the quality of care, so we have early screening, because especially in low middle income countries, the reason we have a lot of deaths and a lot of infirmities for various diseases is mainly because either they don't go for treatment because they feel they have no money to complete it, they delay treatment, or they stop treatment. But if we're able, again, to improve the healthcare system, so yeah, some of our wishes.
I love it, Carmen. Let's do it. And I love your enthusiasm. And so thank you so much for that. And I think turning across to our next speaker, Alejandra Nunes from Unidos contra el Cáncer. Bienvenida, Alejandra. I'm going to stop speaking Spanish here. You have a beautiful language and I will just butcher it. But Alex, thank you so much for joining us.
Estoy muy contenta de esta invitación, de verdad, Rosy, a la UHC.
Perfect. And for those who don't know Alexandra, she is also an absolute powerhouse of enthusiasm and positivity. Alex, I know in 2019 you got involved in the high-level meeting on universal health coverage. So I wanted to understand, you know, how is it that you engaged in that meeting and what was your experience?
Bueno, me involucré en la reunión de alto nivel de las Naciones Unidas gracias a la UHC. Ellos enviaron una invitación y, como decía Carmen, lo veíamos como algo muy abstracto, muy allá, ¿verdad? Que tal vez no iba a tener mucho impacto en el trabajo que hacíamos. Sin embargo, decidimos participar. Creo yo por tener también una capacitación desde la UHC con los programas de formación, y nos sentimos preparados para dar ese paso y participar en una reunión que se salía de lo nacional y de lo regional, pero que sin embargo tenía muchísima importancia para poder conocer las necesidades y los compromisos que se daban dentro de la cobertura universal de la salud.
Fantastic. Thank you for that, Alex. And I think it's great to hear that, as you were saying, you can make that transition from it being kind of academic to something much more concrete. And having seen you doing advocacy, you're an absolute powerhouse. And so I wanted to also dig a bit deeper into, you know, how have you used the high-level meeting process and some of the outcomes to support your own advocacy and the work you've been doing after? As Carmen said, what do we do after the document? And can you tell us a bit more?
Sí, en el tema específico de cáncer, porque nosotros trabajamos específicamente en cáncer, me uní al Consejo Nacional de Cáncer, postulé para poder ser miembro y fui elegida para representar a los pacientes con cáncer dentro de este consejo. Siendo muy estratégica, creía que esa era la manera en la que verdaderamente podíamos tener un voto, ¿verdad? No solamente una voz, sino un voto dentro de los tomadores de decisión. Y bueno, Costa Rica tiene un seguro de salud universal, prácticamente se logra abarcar casi el 90% de la población. Entonces, tenemos mucho alcance en la población y también este consejo está regido por el Ministerio de Salud, que es el rector de la seguridad social en Costa Rica. Entonces, se empezaron a trabajar temas en los que he impulsado personalmente muchísimo el tema de los datos, porque nuestras regiones están escasos de datos y si los tenemos están muy desactualizados. Entonces, se impulsó dentro del Consejo la actualización del Registro Nacional de Tumores, que está en vía, ¿verdad?, de actualización. Esto se hizo gracias a los recursos que se obtienen de la ley antitabaco con el impuesto que se le puso al tabaco. También se está actualizando el Plan Nacional de Cáncer. Creemos que para poder planificar se necesitan datos a corto, a mediano y a largo plazo. Entonces estamos para diciembre de este 2023 logrando ese objetivo también. Y en el tema también de lograr tener muchos más recurso humano que trata el tema del cáncer. Y aquí no estamos solo hablando de oncólogos, cirujanos y oncólogos médicos, sino de todos los equipos interdisciplinarios. El Consejo está trabajando para poder tener más recurso humano, viendo las proyecciones que tenemos también para el 2030 en tema de cáncer. Y creo que Costa Rica tiene muchos retos y muchos desafíos y me uno a Carmen, que tal vez puedo ser muy optimista, pero yo sí considero que Costa Rica trata de mantener sus compromisos con lo que dice, ¿verdad? Y la verdad que hace un gran esfuerzo para poder lograr esa cobertura sanitaria universal. Y manteniéndose en los compromisos que tiene con los objetivos de desarrollo sostenible, especialmente en el 3.8 que habla sobre esto.
Fantastic. Thank you so much for that, Alexandra. And it's fantastic to not only hear that Costa Rica has this council with such a strong patient voice within it, but also the progress that you guys have been helping to drive. I mean, we often hear some fairly negative stories, so it's so heartwarming and wonderful to hear about the work that you're doing. I think I'd like to pose the same question to you as I posed to Carmen and a little bit to Kerry. What would you like us to achieve in 2023? What to you would seem like a win, like a positive? Where can we channel our optimism?
Ok, bueno. Esto es como nosotros decimos aquí, pedirle la carta al niño, ¿verdad? Uno se imagina una reunión como esta y dice, quiero pedirlo todo, pero creo que debemos de ser muy estratégicos en lo que se ha alcanzado y en lo que se ha logrado. El cáncer es complejo, tiene un proceso que va, imagínense, desde la prevención, desde la promoción de la salud hasta el cuidado paliativo, la rehabilitación y la reinserción que tienen las personas en la sociedad como tal. Creo que es importante mencionar lo que hablábamos al principio sobre poner a las personas en el centro, ¿verdad? Tener una atención primaria centrado en la persona, porque en el caso de Costa Rica, ahí es donde tenemos la mayor barrera y poder llegar a este primer nivel de atención con mucha más información, con mucha más fuerza para poder quitar esas brechas que las personas tienen, más que todas las personas que viven en zonas alejadas del país, las poblaciones indígenas, por ejemplo. Y yo específicamente creo que es importante seguir impulsando el acceso oportuno. El tema del tratamiento, creo que el tema de la medicina personalizada es algo fundamental, porque esto nos va a ayudar a utilizar los recursos, los pocos recursos que tenemos, de una manera más específica, donde el paciente va a tener una mejor respuesta, y además el tema de la calidad de vida que tiene este paciente. Hay muchas personas con cáncer que viven con el cáncer de una manera crónica. Ya muchos de los tipos de cáncer se pueden considerar como una enfermedad crónica. Entonces son muchos años donde estos pacientes viven con la enfermedad, y debemos de garantizar que tengan el tratamiento adecuado para que puedan tener calidad de vida. Estas personas pueden trabajar, estas personas pueden viajar, pueden disfrutar con su familia, pueden ser parte de todo del ecosistema que tiene la comunidad, y que necesitan personas como ellos, que sigan impulsando el tema de la calidad de vida. Y el tema de la reinserción laboral, el tema de la rehabilitación, que todavía en nuestros países de nuestra región es algo que no se ha impulsado o desarrollado de la mejor manera como en otros lugares del mundo. Creo que esas serían las cosas más importantes que nosotros podríamos hablar, y tomar en cuenta que la calidad de vida es la percepción que tiene una persona sobre su posición dentro del contexto de la comunidad, ¿verdad? Para poder tener esto como una prioridad dentro de esta reunión. Creo que impulsaría el tema del tratamiento, de la reinserción laboral, de la rehabilitación y de la calidad de vida de estas personas.
Fantastic. Thank you so much for that, Alex. And I think I really appreciate how you help us turn patient-centered and people-centered care into something that's so much more tangible, because I think sometimes we can forget what that means. I now want to hand it over to all of our participants on the line. And we want to ask you sort of two more questions. So we're going to go back to the whiteboard as a new way of kind of exploring how you can communicate directly with us. And we have sort of two key questions. The first is, what progress have you seen in your region? So that's really, yeah, I think we're keen to understand, where have you seen progress? And you can select the little text icon just on the right, and you can drop in what progress you've seen. And then the second is the same question that we've asked to our speakers here today, and that's, would you like to see change? So what is it that we can do differently? What is it that you'd like us to be working on over this high-level meeting to make sure that when we all go back to our countries after the meeting, we have something different? What would you like us to push for, and where can we channel our optimism? So I'll hand it over to everyone to drop your comments in here. If you'd also like to raise your hand, we'd also be happy to give you the floor for the next couple of minutes. So over to you guys. Okay, Shobha, would you like to share your thoughts?
Yes. Hi, good morning. I'm Shobha Krishnan, a women's health specialist from New York. And I was listening to all these wonderful speakers, absolutely inspiring. And it's always nice to see that other people are just as optimistic as sometimes I can become. And couple of things that Dr. Carrie James mentioned, that for the 2023, we are looking for equitable healthcare, maybe integration of various diseases and how primary care can be a pathway. While we're working on several things, it just appears to me that it sounds more abstract. Can we have something like a project to show that, look, what we can do in this particular area and how can we spread it to other diseases and illnesses? And of course, I might sound biased being an OBGYN in women's health, is cervical cancer. I mean, cervical cancer is the poster child for inequities around the world. It can easily be integrated into primary care services, right? Family planning services. And also, we have the ECHO. I'm sure Dr. James is so familiar with the ECHO, where it's a system where you can actually educate people and have them bring in their cases and discuss it with experts and specialists so as to level the playing field as much as possible. So my question is, why not we take this as a project and say, see, this is cervical cancer, this is the progress we have made, let's apply all this to this disease and show how this can be applied to other things. That way, I feel there's something tangible versus, abstract out there. We can do it in this, we can do it over there. Just a thought. Thank you.
Fantastic. Thank you so much, Shobha. That's really kind. And I think it's a great example of showing how we can use some of the larger global initiatives to, as you say, translate the political into the practical. So thank you so much for raising that. And thank you for everyone who's dropping your notes into the whiteboard. That's really kind of you. I believe that I can continue letting people drop notes into the whiteboard, but I'll also wish to share a couple of slides with you, thinking about kind of next steps for the UN high-level meeting. And as UICC, how is it that we can kind of get you guys involved, and what sort of are the next steps from a UICC perspective? So we have a piece of work that's going to be taking place over the next couple of weeks, and that's really going to be to develop an ask document that aims to bridge our day-to-day work and the broader goals of the UHC agenda. So as many of you may be aware, and we'll certainly share it with you, UHC 2030 this time around have identified 8 key action areas. And these span the building blocks of the health system. And after having a little bit of internal consultation, we've, as UICC, have sort of identified 4 key pillars where we thought that we can help to drive some of that work. And they're mentioned here on the slide, but that's recognizing the growing cancer and NCD burden, laying the foundation for a healthy future. So that's really around prevention, closing that care gap, and really kind of identifying, as Shobha pointed out, as did Alex, as did Carmen and Carrie, what is it we can do from a health systems perspective? And the final piece is around investing in health. So in the next sort of week or so, we'll be sharing a draft which builds on those UHC 2030 asks. And we're really keen to hear from the UICC community around what's important to you, what should we be prioritizing. Now that document will be available in English, in French and Spanish. So hopefully will be a version that's most accessible for you. And then the final thing I wanted to sort of touch on, mindful of the fact that we are getting very close to the top of the hour, are a few resources and other opportunities that we have available. So UICC is starting to compile a couple of web pages which we hope are useful. The first is on UHC and cancer more generally, and that's really a compendium of resources and news articles and pieces like that. And the second is a dedicated page on the 2023 UN high-level meeting on UHC, and that's where we're going to be dropping any updates, any more information from our perspective. If you're interested in advocacy more generally, we'd encourage you all to join the UICC Advocacy Network, which is open to all UICC members. We'd encourage everyone to have a think about the work that you've been doing and share that with us. We'd love to showcase it as a blog or a case study. You can reach out to me directly, you can reach out to the advocacy team or membership at UICC. And we'd really love to be able to showcase that to sort of capture some of the optimism and the enthusiasm that we've heard today and really make some of that a bit more sort of tangible when we're talking about UHC and cancer. And the final thing I wanted to flag is that we have a master course running on advocacy for improved cancer control. That's again available in English, French and Spanish, and my apologies that autocorrect has edited that slide for me. The deadline for that is today, which is why we wanted to highlight it with you. But if you have any questions, do reach out to us and we'd really encourage you all to participate in that if it's of interest. So that just leaves me to thank you all so much for everyone who's participated. It's really been a wonderful conversation, and let me thank again our excellent speakers,